Hi, I'm Dr. Richard Nahas. On this episode of the Dr. Eleanor Stein podcast, I'll be talking about blockages, lesions that medicine may have forgotten, and how they might be related to chronic illness and MECFS. And I'll talk about how taking a rational prescribing approach to your healing journey can help you bring evidence to personalized medicine.
Welcome to the Dr. Eleanor Stein podcast. In this show, you will hear expert medical professionals, researchers, and people with lived experience share science-based, low to no cost strategies to help people with complex chronic diseases. Listen in for another dose of education, empowerment, and hope.
Hi, everybody. I am Dr. Ellie Stein, welcoming you to the Dr. Eleanor Stein podcast, a place where I seek out and bring experts on diverse areas of medicine. Today is no exception. We're going to be talking about a skill set about which I know almost nothing. The person who's going to educate us is Dr. Richard Nahas. He's an MD who has practiced integrative medicine for over 20 years, both in Canada and in the United States. His focus is on something called neurotherapy, which treats blockages in the nervous system and connective tissue to help the body heal itself. He's going to explain how helping people heal these blockages not only solves the problem, but actually allows the body to heal better in the future and perhaps even become stronger than when it started. Dr. Nahas spent 2 years traveling the world, honing his craft, studying traditional medicine with indigenous healers in South America, Europe, and Asia. And this led to an integrative medicine practice in Ottawa, Canada, and also in New York. His expertise spans regenerative medicine, neurotherapy, and he prides himself on creating personalized treatment plans for his patients for long-term transformation and not just symptom management. I'm going to get him to talk, of course, about neurotherapy, but also about the bigger context of complementary and integrative medicine. He's served as the president of the Ontario Medical Association Interest Group for Complementary and Integrative Medicine. And this group has 600 members, so it's definitely not insignificant. Dr. Nahas, welcome to the podcast.
Hi, Dr. Ellie. Thanks for having me. Great to be here.
You are welcome. I like to start by asking my guests how they came to be interested in their current areas of interest. In your case, neurotherapy. You started out in a fairly conventional way studying family medicine and anesthesiology. What was your path? How did you end up being interested in complementary approaches and neurotherapy in particular?
Well, we often only understand our path when we look at it in hindsight, but I think I was led down this path from the beginning. Always really curious about uh, how the body works and how we get sick and how we heal.
Mm-hmm.
And to be quite honest, I was disappointed when I learned that medicine didn't really have the answers to those fundamental questions in medical school.
Right.
Uh, and it was not until till I got into my clinical clerkship when I was dealing with real people that I felt like I was in the right place. And I really enjoyed patient care, and I enjoyed making a difference. So I ended up gravitating to emergency medicine. And I started in anesthesia because of some of those critical care skills that are so important. But I ended up working as a full-time ER physician for about 4 years in Toronto, in the GTA, and in a few underserviced areas in Ontario. And My light bulb moment came when SARS came to
Okay.
Toronto
The first time around.
the first time in
Yeah.
2003. So I was working at an ER that was closed and quarantined. So I ended up taking a position with Toronto Public Health and the CDC. I was looking after inpatients as a hospitalist
Mhm.
with SARS, and shared a pager with a friend for a hectic few months. And when everything was said and done, we learned that the odds of dying of SARS were twice as high if you were diabetic. Similar to COVID.
I was just gonna say, now that sounds very familiar.
Yeah, but it was sort of a light bulb moment for me because we were really mobilizing all of this technology and these resources to dealing with the virus. But we really had nothing in our arsenal that was focused on helping the body heal itself.
Right.
And I had always wanted to travel, and I saw a window of opportunity, so I decided to pack a bag and put my career on hold for a while, and I went to South America. And over about 2 years, I spent time with a number of different uh, mentors. Some of them were medically trained, others were traditional healers. And I spent time studying plants and acupuncture and got into nutrition and explored the concept of chi and energy. And all of these ideas were added layers to the training I got in medical school. And I decided to set up a shingle in my hometown of Ottawa. And it was initially an general integrative medicine practice. No matter what your health condition is, uh, how can an integrative approach uh, give you better outcomes?
Yeah.
And over time, I explored things like diabetes, cardiovascular disease. I published a series of evidence-based reviews in Canadian Family Physician, looking at the evidence for a few different options for, some of the most common complaints that docs will see in the office. And I was really struggling with some of the limitations of the paradigm that we work within. And, the seeing a lot of the barriers that any potential treatment faces in a world where, evidence-based medicine is really tailor-made to suit uh, pharmaceutical drugs. Uh, and I was working on a number of levels, but always with an evidence-based perspective. And then I discovered neural therapy. And, in the same way that, many physicians have an aha moment where they they see this big horizon of alternatives beyond what we learned in medical school. Everything sort of clicked into place for me when I found neural therapy because, we can talk about this, but neural therapy involves injecting with a local anesthetic the places where you've been hurt before, based on the assumption that those areas are sensitive and more prone to triggering stress. And when I was in South America, I was working with healers who were speaking the same language, but they were using animal spirits and other metaphors to describe these lesions, which on a very basic level as a human being, any person, regardless of their education, can understand that if you've been hurt before, maybe that's a weak spot for you.
Mhm.
But it was shocking to me that there's no language for this in medicine, and
It's
that
true.
these lesions are totally forgotten. So, since then I've been really more and more focused on treating chronic pain, and more and more focused on uh, not just taking care of my patients in the best way I can, but seeing the next chapter of my career in terms of creating awareness about these lesions that medicine forgot. And if it's true that the places we've been hurt before are worth treating, and that the body will heal itself when they're treated, well, that seems to be something of historic importance.
Right.
That's kind of what motivates me when I go to work every day, and it's been quite a convoluted journey, but it's I think it's a concept that's long overdue.
I'm just thinking, you're making me think back to how I first heard about neurotherapy. It was from my patients with chronic pain, especially fibromyalgia. And I remember, so this was in Calgary. So I think there are a few people, maybe they're not calling it that, but sounds very similar to what you're describing with injecting local anesthetic in spots. I'm going to ask you more about how you figure out what those spots should be. And some people just swore by it. They went regularly, maybe every couple weeks or something, and it kept them going. And because I didn't have any understanding, I was just neutral. Like, I couldn't really support them in it or guide them in a different direction. I just kind of observed. And so when I came across your name, because I think you've also served as the president of the, I don't know, big group of neurotherapists. I don't know what your international organization or North American organization. So I thought, well, who better to explain what it's all about?
Yeah, well, I am very proud to serve as the president of the North American Academy
There we go.
of Therapy.
Yeah.
And we have a couple hundred members. So there are some providers in Western Canada doing neurotherapy,
Okay.
uh, but it's very little known in North America compared to the thousands of doctors throughout Europe and Latin America who do neurotherapy, uh, just because of how it evolved in a different language in a different country.
Maybe can you share a little? It evolved in Germany, is that right?
That's right. In the 1920s,
Wow.
uh, a pair of brothers, one doctor, one dentist, Walter and Ferdinand Huneke, their names are Huneke.
Okay.
And so in Europe, they call it neurotherapy nach Huneke, or according to Huneke. So the way it was discovered was kind of serendipitous, like many things in medicine are. This was at a time when Procaine, which was also called Novocaine. That's sort of how it's socially known. It's referred to in the movies and whatnot. But it was developed just at the turn of the century as an alternative to cocaine.
Oh,
And it was used as a local anesthetic for surgery primarily. And it eventually became widely used for the treatment of pain. This was before the time when there were really painkillers available. Prescribed
right.
pharmaceuticals were not widely used. And so at the time, there were lots of doctors treating patients by injecting the places where they hurt. Logical concept. And that's quite similar to the trigger point injection
Mhm.
approach that many people with fibromyalgia pursue with some success, and other myofascial pain disorders. But with this one case, there's an apocryphal story of uh, a patient who had a persistent neck and shoulder pain. And when They reviewed the history. The story revealed that she had had an osteomyelitis, a bone infection in her leg as a young woman. And they injected the leg over an area where they saw just a small patch of redness where the infection occurred years before. And the head and neck and shoulder pain disappeared and never returned. And so that was immediate, and they called it a lightning reaction. And it's not always the case, but it's very satisfying when you inject an area remote from the pain.
Mhm.
The patient experiences something that they can't deny, and it changes their paradigm in that moment.
And so as I listen to that, I think, okay, so does that mean the neural therapy is acting on I guess people think it's nerves because they've called it neural therapy, or is it that it's acting on connective tissue, or how do you explain that effect that you inject one place where an injury or trauma occurred in the past and pain in a different location could respond?
Well, this is the beauty of what you call a holistic perspective, right?
Right.
So holistic medicine is not just about natural therapies. It's about thinking of the body as a whole. And so if you recognize that every part of you has nerves that are one end of a circuit, and that circuit travels through the tissue into the spine, and then it meets another cell that travels up to the brain, and another cell that processes in the brain. And then there's a reaction, and that sends an impulse traveling down the same pathway. And you recognize that you only have one brain. And
Right.
those pathways all travel to the way I describe it to patients is they all travel to the same CPU. And uh, the nervous system as a whole has a part of it that we call the autonomic nervous
Mhm.
system. And that's really the key part that explains how neural therapy makes sense. Because that's the part of you that controls the fight or flight response, the stress response. And, we think of stress as a whole person phenomenon, but it turns out that there are sympathetic fibers in every nerve ending. And if you have a wound that has not healed completely, then those fibers can be firing
Mhm.
and again, inappropriately triggering a stress response that affects the whole CPU.
And sorry, what's a CPU?
The central processing unit,
Oh, okay, like of the body.
like a microchip, you only have one operating system.
Yeah, yeah.
And neurotherapy has always talked about what they call the regulatory system. And, recent insights are now revealing that the autonomic nervous system is intimately linked with the immune system and the endocrine system, and it shapes our thoughts and our emotions. So, this emerging field that we call psychoneuroimmunology,
Mhm.
it talks about how this stress response from an old wound can trigger changes in the whole network. And so if you have an infected root canal and a tonsil that was affected several times and a rib that was broken and a dog bite, those areas, some of them may just be sensitive nerves and uh, disorganized connective tissue. Some of them may be more inflamed.
Right.
Some of them may have a burden of microbes that triggers an immune response. And so you can see downstream effects where these lesions can affect not just the nervous system, but the immune system, the endocrine system, and all of those, what we call functional disorders,
Right.
out of the multisystem vague complaints. And that fits really well with MECFS.
So because people go, there's strong feelings about the use of that word. So by functional, we're not, just for clarity, we're not saying it doesn't exist or it's not real. We're just saying there's not an observable lesion. It's not like cancer where you can see, oh, there's the problem right there. It's that the body isn't functioning right.
Yeah, one of the challenges I had in medical school was learning the language
Right.
of medicine, and everything is sort of spoken in code. And from my perspective, a functional disorder is what we call it when all of your tests are normal
Right.
and you have complaints that we can't explain. So I also sometimes will tell patients that there's a difference between a hardware problem and a software problem. So we can do an MRI of your brain and everything looks all right structurally, but it's not behaving properly. It's a
Right.
functional disorder.
And again, just for clarity, functional disorders can be extremely serious, right? They can be totally debilitating. So it's also not code for not serious or not real. It's really code for, yeah, our medical system is just fallen behind. It doesn't have ways to measure it.
And that, I think, it is the key message. It's not just that it doesn't have a way to measure it, it doesn't have a way to explain it.
Right. Or understand it.
But if you understand it as a nervous system that's just fried and has been overwhelmed, or if your nervous system is always reacting
Hmm.
inappropriately to stresses, and that stress response includes things like fatigue or brain fog or pain.
Hmm.
Uh, but your MRI looks fine. Your physical examination looks normal. Well, we just put it into a category that we call functional.
Okay. And so let me just recap. I think, as soon as you start talking about the autonomic nervous system, people listening are going to go, like their ears are going to perk up because in our field, it seems like this is an underlying problem that just keeps coming up. No matter how you approach from different sides, you end up with the dysregulated autonomic nervous system, maybe not being the whole cause, but very central to the problem. And so are you saying that when you do these injections into the specific locations, you're able to change the autonomic nervous system function?
Well, I always want what I say to be grounded in evidence.
Right.
And the one paper that I always like to cite is a paper it's open access. It was published by two of my colleagues with an associate, Dr. David Vinyas in Barcelona and Dr. Lawrence Fisher in Switzerland. It was a scoping review,
Mhm.
129 studies. It was published in the Journal of Clinical Medicine in 2023. And they didn't talk about neurotherapy per se. They talked about the therapeutic use of local anesthetics. And there's very consistent, positive evidence. Hard to aggregate the data because all the studies involve different patient populations. So, if you're a die-hard epidemiologist, you wouldn't call it level 1 evidence.
Mhm.
But certainly a lot of the clinical experience has been in patients who, meet this clinical criteria of MECFS.
Okay, interesting.
Myofascial pain, generalized pain, pain and comorbid cognitive or mood disorders, central sensitization. And so uh, the thing that I like to emphasize is that it doesn't have to be an injection that treats these areas. Just recognizing that these areas might be an issue for you allows you to target those areas even with gentle, non-invasive approaches, whether it's stretching or essential oils, or whether you talk to your rehabilitation provider and they include some of these previous injured areas in your acupuncture or your massage or your osteopathic regimen. I encourage people to do that because, unfortunately, there are not a lot of doctors yet in North America who are trained in neurotherapy.
Right. So you might, for many people, practically speaking, they may have to look for other approaches.
Yeah, and just recognizing that, I think that the message you can use right after listening to this interview is to sort of reflect on your injury history and make a list of all the bones you've broken, the surgeries you've had, the tissues that have maybe had recurrent infections, uh, and think about all of the hot spots in your body and how taking a whole person approach might help you better manage your condition as a whole body condition.
So an effective approach would be to use some treatment, whether it's injection or, like you said, something less invasive that kind of gives the nervous system the message that it's okay, that allows it to turn off the danger alarm.
That's right.
Okay.
And I think we're at the very early stages of this because, you're a medical doctor. You have been exposed to many different aspects of clinical practice. You've never encountered this concept before.
No, but just indirectly through patients.
Mhm.
Yeah.
So it's hard to refer, for example, a patient who has chronic sinusitis and
Mm.
uh, recognizing that scents trigger brain fog and that might be related to an interference field. That's what we call it in neurotherapy. The German term is a Störfeld or a disturbance field. So you have noise, electrical noise being produced by the nerves that supply a sinus. And so maybe you use a tapping exercise. Maybe you use nasal irrigation. Maybe uh, the next time you see your acupuncturist or a massage therapist for your neck pain, they may look at a connection between the midface and the neck and traps. Just having that perspective that all of these areas are connected and your symptoms may be coming from any one of your scars. And at the end of the day, it's coming from the total load in your nervous system, which includes all of your scars.
And would that include also emotional scars, even though I don't know how you would localize them on the body?
Well, that's a very interesting subject because, of course, they're significant. And I know that many of us who treat pain have had to try to help patients untangle the link between emotional trauma and chronic pain because often patients get the message uh, mistakenly that what we're implying is that their pain is somehow in their head or that it's just because they're emotional.
Right.
But the way I describe it is that these are short circuits. And in the same way that you can have a disturbed circuit triggered by a scar that affects the wrist, you can have uh, a disturbed circuit in your nervous system that's related to an emotionally traumatic event. And there are different ways to target those. There are some neurotherapy approaches, but it's also interesting what happens when you treat a patient while asking them to explore some of those previous difficult memories or their thoughts or their feelings. Some of my colleagues will use eye movements, EMDR, those sorts of techniques. Uh, Tapping techniques have been helpful. And then, of course, there are other layers related to, so if you would do a neurotherapy procedure and you would turn off stressors in the nervous system, patients often will report a feeling of sort of being more relaxed and light. But there's also a 1 to 2 day window when they are more open to exploring traumatic memories. So that's a good time for them to engage in art therapy or journaling or music therapy to get into the emotional side.
Hmm.
Uh, there are some approaches to healing that are very anatomical, but there are other approaches that can access these disturbed circuits in other ways.
I'm just, again, this might be a bit digressive, but I've been listening to people talk about how, say, psilocybin works therapeutically for trauma. And my understanding is it kind of opens a window for neuroplastic change. And I wonder if it might be something similar that you do the injection or the treatment that calms down, we'll call it a hot spot, and it opens the possibility that you could process or rethink maybe the original trauma.
Well, you're touching on some fascinating science. And the truth is, one of my objectives as the president of this academy is to try to put together a program of research that includes, having some consensus about what kinds of studies we need to see next.
Mhm.
Because QEEG, or
Yeah.
quantitative EEG testing, is something that's now being used to give us real insight into what's going on in the brain with MECFS and other conditions in terms of, you're producing more brain waves in this range, this frequency range, or
Mhm.
this part of your brain is overactive. But there are also ways to use that technology to measure a change before and after a treatment, for example. And similarly, uh, a lot of us are doing ultrasound guided injections now in the regenerative medicine space. And if I'm injecting a scar under ultrasound guidance, there's some equipment now that can actually objectively measure tissue tension.
Wow.
It's called shear wave elastography. So again, before and after changes uh, are going to be really essential to
Yeah.
confirming that this lesion is actually a real thing and that treating it shifts the body in a positive direction. That's what's really needed.
Wow, that's really fascinating. I've never heard of that technology. I get the sense, and you can correct me if I'm wrong, that connective tissue is also kind of thought to be central to this. And I don't know if it's just because the connective tissue is surrounding the nerves or because um, the scars involve connective tissue, or I've just been learning madly over the past year or so about quantum biology, And from what I gather, connective tissue is now thought to be like the quantum conduit of communication throughout, like instantaneous communication body wide. So when I heard about neurotherapy kind of involving the connective tissue, I thought, ooh, that's very exciting.
Absolutely. Um, that's my uh, baby. So fascia is a tissue, another thing that medicine forgot.
Right. We push it off to the side, like, having sat in on surgeries and dissections, they just, oh, that's nothing. Like it's not even mentioned. It's just in the way. You have to move it to the side so you can get to the real things like the muscles or the nerves.
Absolutely.
Yeah.
So I'll tell you, 3 or 4 things about fascia that are important to know.
Mm-hmm.
The first is that fascia is filled with nerves. It's one of the most richly innervated tissues in the body, second only to skin. And studies have shown that uh, areas that have been injured have more nerves in the fascia. The second thing that's important to know is that if a wound heals, the collagen fibers are not perfectly symmetrical the way they were in native tissue. They kind of heal in a mangled way.
Mm-hmm.
And those disorganized fibers can actually sometimes wrap around a nerve and choke it. And
Wow.
cause, if it's choking one of the very tiny distal branches, that's a branch of a long neuron. So that whole neuron becomes sensitized. And the thing that I find most fascinating is that fascia is made of collagen. And what we know now is that collagen, the structure of collagen is crystalline,
Mm.
and its piezoelectric properties have been confirmed in laboratory experiments. What that means is that every time your nervous system generates an action potential, every time there's an electrical impulse that travels through your body, it echoes through your fascia as a vibration. So piezoelectric substances turn electrical waves into mechanical waves or sound waves. And so, because all of the fascia is connected in this sort of whole body network, this is what we talk about when we say that there's a whole body instantaneous communication.
Right.
The fascial network actually connects every single cell to every other cell.
Yeah.
It's mind-boggling. And so the over the years, as I've been working with neurotherapy, and you find a point of tension where there's a sensitized nerve, and you inject that area, and you see what happens, not just in the area, but you observe what happens to the extremity, and to the patient as a whole. You start to see how different points are connected. And what I've come to appreciate is that all of the acupuncture channels in the body are simply referring to different sections of fascia. And there's a very simple way to understand how we're built that basically divides us in 3 sections. And, they described 6 acupuncture channels in the arm. Those are just 3 pairs of meridians. And it's like the arm divided in 3 slices. And that explains a lot about how something that happens to your wrist could contribute to pain in your neck.
Right.
And fascia is revealing the new anatomy, and it's critical to understanding how the body works. And so recognizing that this is how you're built, and that these little knots, these hot spots, can affect how the long chains move. It's just a totally new way of understanding what might be wrong with you. And
Right.
it gives you a path that is personalized to you, to recovery, to focus on your unique lesions.
Right. So that's what makes it individualized. Everyone is going to point, and I know you on your website you have a chart to kind of list all the hot spots. Um, I have the question of whether, like, could anybody benefit from this, or do you have to have pain or a certain type of pain? How do you kind of select people for this therapy?
Well, I am trying to build a practice based on my professional goals. And I am focusing on post-surgical pain
Okay.
because better outcomes are very relevant to the healthcare system. And I wanted to find a thin wedge that I could
Hmm.
use to allow neurotherapy to have an impact in a way that insurance companies will care about, hospitals will care about, and patients will care about. But the truth of the matter is that we have all got weak spots. I like to tell my patients, we're all broken and we're all beautiful, and as long as you've got a pulse, you can still heal. But
I just want to pause. That's such a great message because, as you probably know, in this community of complex chronic disease, so many people have given up because they've just been sick for so long.
of course, and
Yeah.
one of the things that we don't get taught enough about in medicine is how devastating the illness experience can be. And by the time many of my patients find me, uh, they may have lost their careers. A lot of their family relationships and social
Yeah.
relationships have changed. And in many cases, their spirits have been broken. And uh, I don't like to make promises. And so I don't ever tell people that I'm going to be the solution. But I think it's important that, and this is where the kind of the evidence-based approach comes into play, is that we can't predict in advance what's going to help you. So you have to keep trying different things until you find what works for you.
Yeah.
But one thing that everyone should do if they haven't thought about it before is to recognize where they may have blockages and target those with their current team of providers.
And how would they know, "Oh, I've got a blockage here," because it hurts, because it's red, because it's swollen, because it flares on rainy days, all of the above?
Sometimes there are clues, and certainly if you had a fall on your tailbone and you've had hip pain ever since that day, that's a clear connection that you have to keep in mind when deciding which blockages matter most for you. Similarly, sometimes I'll see a patient with a long abdominal scar, and there's, maybe a 6-inch scar, and there's a 1-inch patch that is red and
Mm.
thick and tender. And so it's quite obvious. But some of my colleagues will treat every scar at every visit because they believe that uh, that's the best approach. But
So you do need to do it repeatedly, like it's not just one injection and everything goes away. The body's been kind of in this dysfunction for a while, so it's gonna take, sounds like, some time and maybe repeated treatments to kind of shift.
for the for the population of folks who have ME/CFS,
Mhm.
it's likely that a series of treatments will be needed.
Okay.
And it may be that uh, there's an aggravation for a day or two after a treatment, similar to what they experience with almost any treatment.
Right.
But what's different is that there should be unexpected positive things, and there should be progress from one visit to the next. And when I recommend anything to anyone, I'm aware that this recommendation is competing with many other things. So uh, you have to be clear about what you're recommending. And so when I think about a trial of something like neurotherapy, if you can find someone in your area who can deliver neurotherapy to you, I would commit to anywhere from 3 to 6 sessions with that person.
And how far apart would the sessions typically be?
In some cases, they can be just a few days apart. And in some cases, it's helpful to see people on consecutive days to see how things evolve.
Okay, so it can change that fast.
Well, in many cases, there is an immediate response, which
Okay.
is positive. Most patients leave the office feeling very good. The question is what happens after that. So
Right.
in some cases, it will persist for quite some time. In other cases, there may be an aggravation that follows it. So when I can, I like to see people 2 days in a row uh, because the problems that surface 24 hours later are likely to reveal what's the core issue with that
Mhm.
individual person. But many of my colleagues will see people 1, 2, 3, 4 weeks apart. Uh, and again, this is not guided by evidence. It's guided by almost a century of anecdotal experience,
Right.
but it varies worldwide.
And maybe a final question on neural therapy. Are there some people who are bad candidates and you would advise to go in a different direction? And what are the side effects?
Well, that's a good question. I think that uh, the more the more medication that you're on, that
Mm.
the family of drugs that regulate the nervous system, whether you're talking about drugs that affect pain, mood, sleep, or whether you're talking about beta blockers or other alpha blockers, alpha agonists, those kinds of things. Not that you shouldn't use neurotherapy, but recognize that if you're taking something to stop your body from doing what it does naturally,
Right.
any treatment that's designed to elicit a response from the body won't have its full benefit if you're blocking that.
Okay, that makes sense. And what about side effects? You mentioned people might have a little bit of an exacerbation in the day or two after. Are there any other things people should be aware of?
I'm talking mostly about, I would guess, what I would call lymphatic issues. So,
Okay.
some people would call this a Herxheimer response. Some people would call it a healing crisis. Essentially, if you do anything that stimulates the body to get moving and to start clearing fluids and draining wastes and uh, it gets stuck somewhere else, then that would create an aggravation.
Okay.
And so I think, in my experience, a lot of this MECFS syndrome is related to, it affects multiple parts, but there's a lot related to mast cells
Yeah.
and immune function, and that's quite closely related to the lymph, especially around the head and neck. All of the lymphatic vessels from the arms and the legs, they drain into the torso, and they sort of drain through this thoracic duct in the neck before they get into the mediastinum in the heart. So all of the injuries that can contribute to what you'd call a blockage in the lymphatic drainage
Mhm.
can trigger an aggravation, because this is where everything ends up.
Right. I just want to shift for our last few minutes to the bigger picture of complementary and integrative medicine. And from kind of reading a little bit about what you do, you're also a big advocate to try to make the evidence for some of these treatments more widely visible, let's say, so that they may kind of ease it more into the mainstream, especially treatments that actually have pretty solid evidence behind them. I was just wondering if you can talk about, I don't know, your views about complementary medicine and your own efforts to get it more recognized.
I appreciate you asking about that, because it's a very important issue for all of us. Um, I think evidence-based medicine was really a blessing, but it had unintended consequences. And one of those is that there's a real barrier to the adoption of anything that isn't supported by solid evidence. And uh, throughout my career, I encountered a number of reasons why it's so hard to get good evidence for complementary therapies.
What are some of those reasons? Because a lot of people listening or who are more, or maybe even practitioners who are conventionally trained, if there's no, meta-analysis of randomized controlled trials, they kind of dismiss it and just assume it's a lesser quality of therapy.
Well, it's a therapy that's less amenable to being tested by the tools of evidence-based medicine that we typically rely on.
Mhm.
So if you're an academic clinician and you want to do a study on something in the complementary medicine space, it'll be tough to get funding,
Right.
and you're not doing your career any favors. It's not the most highly admired field to pursue. Uh, if you do get the study published, uh, depending on what the intervention is, it may be difficult to find a placebo.
Right.
Like, what's a placebo acupuncture intervention? It's certainly difficult to standardize the intervention. So if it's acupuncture, are they always using the same points? Uh, or does it matter who the provider is? If it's a herb or a vitamin, there are different doses, different uh, parts of the plant that were collected,
Yeah.
different extraction methods. So it's very difficult to aggregate the data. And uh, as a consumer, you can't assume that what you're buying is the same as what was studied.
Yeah.
So it becomes very difficult to apply the tools that we were trained in. So we need different tools.
Right.
And what I've been doing in my practice, because I treat pain, I can use patients' feedback to tell me what's working and what's not. Because if this thing that we tried has helped you hurt less or sleep better or has improved your mood. And I have used what I call a rational prescribing approach with all my patients. Try one thing at a time. We'll choose the right product. We'll choose the right dose. We'll decide how long we're going to test it. We're going to try to be clear about what is our benchmark for improvement. And then when you come back, you'll tell me whether it worked or not. And if it worked, we'll keep using it. If not, we'll try something else. This is how we're supposed to practice medicine. This is
Right.
a framework that is promoted by the World Health Organization for prescribing everything.
But it doesn't work with a randomized trial because there you have to guess at the dose. You have to give the same dose to every single person at the same interval and for the same duration. And you're not allowed to shift gears if you're getting negative feedback.
Well, and if you look at it, something like MECFS, and you recognize that there are all kinds of factors that are at play to different degrees in each patient.
Right.
It's gut health or hormone imbalances or emotional trauma or mast cell activation or neurotherapy related blockages and scars. So the project that I'm working on is called the Beam Project, bringing evidence to alternative medicine.
Oh, I love that name. That is fantastic.
And the idea is it's very simple, that you are your own study. And if you're going to navigate your journey, you want to try one thing at a time and see what works. And so it's a tool that allows your providers to quickly fill out a form to tell us what happened in the visit. And that will be linked to data that you as the patient provide telling us how you're doing. And so an individual patient can figure out what's working for them and what's not. And we can aggregate this data to find out what works best for certain groups of patients. Or we can find out if there are a whole group of acupuncturists, which ones are getting the best results and why.
Right.
So the idea of crowdsourcing evidence at the point of care, using all of us who are working in this space, struggling with our illness by ourselves, putting all this data together to give us a resource that we can use as a society to have some sense of what benefits there might be from integrative solutions for different patients in different settings.
So what does this practically look like? It sounds like an app, perhaps, and the providers and the patients both enter their data. And it sounds a little bit expensive because now you need someone to kind of pool that data and look for patterns in it.
Well, we're trying to find a model that makes it almost free
Okay.
for patients and that doesn't put too much of a burden on providers' time.
Right.
Uh, the goal is to make sure that providers can document what they did in 1 minute or less
Wow. Fabulous.
at the point of care. And then, patients will have to fill out some questionnaires every week or two, but on a daily basis, they'll just be replying to a notification. How are you feeling right now? How was your day today? Just respond quickly from 1 to 10
Mhm.
to make it less intrusive. And so we're
And
working with,
I was just going to ask, I think you're going to just jump into how you're actually rolling it out, maybe in a pilot form.
Yeah, we're developing this with some researchers at Waterloo University, and we're starting with the acupuncture community in the Toronto area. And we want to capture what they're doing in a treatment and correlate that with how their patients are doing. And based on that experience, the next goal will be to take that to the neurotherapy community, because there are, thousands of doctors around the world who are all working towards the same goal, but they're doing it in slightly different ways, and we'd love to learn what's best.
Wow, that's fabulous. Just as we wrap up, uh, say someone listening to this says, "Boy, I have a bunch of owies. This sounds like it could really have potential for me." How would they find a neurotherapist?
NAANT.org.
Okay, naant.org. Perfect.
Academy for Neurotherapy.
And if go ahead.
And we have a find a provider map.
Oh, fantastic.
And if you don't have a provider in your community, I would urge you to share the website with your local providers and invite them to explore neurotherapy and attend a workshop. We're having an international conference in New York City in October 2026
Okay.
from the 7th to the 11th. So I'll just
Wow.
plug in there. We'll have experts from around the world talking about neurotherapy.
And you offer training as well?
That's right.
Okay.
There are a few experienced doctors who are running workshops regularly uh, in Seattle and Portland and in the New York area. And um, interestingly, that includes nurse practitioners, naturopathic doctors who can inject some states, medical doctors, and doctors of osteopathy who are all licensed to inject. But I'm also very keen to connect with rehabilitation providers, because I think
Mm,
even if you're not an injector, if you know that your client or your patient's pain might be related to those old injuries, you can explore those as part of what you already do. And I'm really hoping to facilitate more collaboration and more focus on these lesions that medicine forgot.
Thank you so much. This was really fascinating, and I think the listeners are really gonna appreciate what for many will be a whole new possibility for them.
That's
Any final words you wanna leave people with?
reconnect with your body. And even when your body is making you suffer, uh, make your body your friend and love your body. And the more you can pay attention to what your body's doing without hating it,
Right.
the less you will suffer. And that's a path to greater awareness.
Oh, thanks so much. I really appreciate your time and expertise.
Thank you so much. Keep up the great work.
You're welcome.
Thanks for joining me on the Dr. Eleanor Stein podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.